assisting us in organizing this event. We're going to begin with remarks from Mr. Peter Melhado, the Chair of the Logistics and Operations Committee at PSVI.
Minister, one of the great benefits of being vaccinated, I feel comfortable to take my mask off while I speak. I know you always do so. But Honorable Minister, Mariko Kagoshima, my colleague at UNICEF, all colleagues here today, ladies and gentlemen. Today I would like to share a brief presentation just outlining how we got here today and where we are. As everybody knows, COVID-19 has had a massive impact on the lives and livelihoods of all Jamaicans. And the private sector felt compelled to play its part in the recovery of our beloved country from this pandemic, particularly in regard to assisting with the National Vaccination Plan. This effort led us to signing our first MOU, which was with the Ministry of Health on February 17, and our focus was on 3 main areas: to provide technical and financial assistance to the National Vaccination Plan, to accelerate the transition, which was with the Ministry of Health, to herd immunity, or population immunity. Our focus was on the key, in our view, to getting businesses back up and running on a sustainable basis. And finally, to donate vaccines to select public sector entities. So the team got work with the first order of business being to invite a number of providers to the table for us to demonstrate their software, for us to choose a best-in-class software solution for Jamaica and the vaccine initiative. And I'd like everybody to know that one of the key criterion in developing this was data security, a big emphasis on data security as part of the requirements for the vaccination platform software. I think we have to go one more over on this presentation. Thank you very much. The winner was a US-based company, and we worked with them on a very tight timeline. The minister put us on an extremely tight timeline to localize the platform to our environment. This work was underwritten 100% by UNICEF, so big props to UNICEF, and really thank them for this contribution to the cause. We also worked in parallel to modify the existing scheduling software for the COVID-19 testing site to adapt it to take appointments for vaccines, with the added benefit of capturing 17 key data points on the front end so that we could reduce the time spent by customers at the vaccination site. I think we need to go one more over on the slides, please. Thanks. So, the scheduler uses logic to translate the inventory assigned at the back end by the Ministry of Health administrators, and it sets up appointments in hourly time slots, making it a very efficient online system for the customer as well as for the ministry. So this is kind of a big deal. The minister tasked us with having a proper modern digital front end to our system, and hopefully if anyone here has used the system, you'll see that we really have a very a system with some significant efficacies. And then finally, we oversaw the integration of the 2 systems so that they could work seamlessly together, so that when you go on and make your reservation on the scheduling software, that populates the database in the vaccine platform. And so when you arrive for your appointment, you're all there. All your data that you've entered is there, and all the admin team at the site have to do. Actually, we have a very cool feature where they'll scan your barcode, which you'll get with your invitation to come to whichever clinic it is, and they'll scan your barcode, and this populates the data in the database, and they can recognize you right away. Only 3 data points that we end up having to be entered at the site are the vaccine type, the batch number, and the expiry date of the vaccine. So we're very efficient once our customers come on site. So that was integration, and then obviously there was a period of extensive training of the workforce at the ministry, starting with a kind of train-the-train approach with all the MIS folks at the ministry, and then that fed down through the system so that everybody who administers vaccines is trained on the system. So, Minister, we've gotten a very good adoption so far. We still have a little paper floating around, but we're almost paperless, and we're committed to getting to entirely paperless. But we do have an end-to-end online or walk-in digital system to register with a secure database on the back end, capable of reporting across all data fields. So if you see on the presentation there, you can see if we wanted to know how many ladies over 60 years old in Clarendon were vaccinated between May 25th and May 29th with what vaccine, we can produce that report effortlessly. So that was our main role from the technical standpoint. Perhaps you could just advance the slide one more, thanks. But we're also involved on the financial side. I know the press always likes to know numbers whenever we say we're involved from the financial side. So we're about 25 million Jamaican dollars to date. And our major expenditures were retaining a project manager to oversee all aspects of the implementation cycle. Turned out to be an excellent investment because it's really brought the project together. We donated 400 tablets. In fact, the last time we were here, Minister Mariko, we were doing the tablets. The tablets have performed well in the field. If you go to a vaccination site, you'll see we're well equipped with tablets. We also played up along with UNICEF in funding and managing the data entry because we had 130-something thousand manual records that needed to be entered into the system. I think we've closed that gap to just a few thousand records not yet entered. And then obviously we provided many hours of subject matter experts, especially during the software selection and modification process. I really have to shout out my private sector colleagues who gave their time very generously in this regard. And then finally, especially on Blitz Day, we do a lot of help with refreshment support and tents and all of that kind of thing. So that's what we've been doing. So if I could leave you, Minister, with one thing, that is to say that we are absolutely committed to continuing our support of the NVP right through to the point where we attain population immunity. That date, Minister, we hope we can firm up as vaccines become more free, but we're definitely committed to that, and we will continue both on the logistical and technical support side. We think a very important part of getting to when we get to phase 2 is actually mobilizing the productive sector to make sure that the take-up rate is high. So we're going to really work hard on pre-registering all of our employees within the various business sectors. And so that when we get to phase 2, we'll have folks ready to come and take up the vaccine. And then obviously to continue to provide financial assistance where needed. So, Minister, I have to say it's been an absolute pleasure and a privilege working with the ministry and working with who I now call my colleagues in the Ministry of Health and also UNICEF. Many hours on many Microsoft Teams calls to get this done. And I really believe that what we've done here serves as an example of how the private and public sectors can work together along with the multilateral agencies to effect real results in these challenging times. So I know we're going to have a little ceremony to hand over the software officially, but thanks again for the opportunity, Minister. It's been a real pleasure for us.
Thank you, Mr. Melhedo, and thanks to the team at the Private Sector Vaccine Initiative. And of course, it's made up of the Private Sector Organization of Jamaica, the Jamaica Chamber of Commerce, and the Jamaica Manufacturers and Exporters Association. So thank you for your continued support and partnership. We're going to hear now remarks from the UNICEF Jamaica Country Representative. Let's welcome Ms. Mariko Kagoshima.
I'm going to take my mask off because I was able to get a second vaccination on Saturday. And then my mother in Japan, she hasn't even got the first dose, and she's really surprised that I got, and very jealous as well. She's getting the first dose today, apparently. But anyway, good morning, Honorable Dr. Minister Tafton. Good morning, Peter. It's been a pleasure to be here. Some people may be wondering why UNICEF, a UN agency working for children, is engaged in this particular partnership. We are involved for two reasons. First is that UNICEF is the world's largest provider of vaccines. We procure more than 2 billion doses of vaccines annually for routine immunization and outbreak response on behalf of nearly 100 countries. As such, UNICEF is leading the procurement of vaccines through the global COVAX facility, in partnership with PAHO, of course, which the government of Jamaica has been using to get vaccine doses. Secondly, and the reason we are here this morning is that UNICEF is providing the government of Jamaica with a digital health platform called ComCare to help manage the vaccine rollout. This COVID-19 digital platform is also one of the first of its kind implemented for the COVID-19 vaccination rollout globally. So when Minister Yu approached us, I called our headquarters, and then they're like, let's see, I haven't heard. This is something which is needed, but nobody came up with it. Let's try. So thank you for taking risk with us, but this is one of the first of the vaccine digital platform in the world. So we can be very proud of it. So I would like to say this is a demonstration of a strong drive and leadership by the Ministry of Health and the Minister Tafton Yu for the transformation and modernization of the health sector here in Jamaica. And UNICEF is grateful, really grateful to be a part of this innovative initiative. And I have no doubt that this serves as an important foundation to build upon towards the acceleration and then accelerated digitalization of the management of the essential health services. I would like to add one more thing. Minister, government of Japan has contributed with $1.1 million to Jamaica to strengthen cold chain and immunization services. And then I'm sure that this funding can be used to further strengthen this digital health platform, as well as cold chain procurement. I have been in contact with Dr. Ines. She was mentioning the needs for the car with the freezer abilities, and then we're exploring how best we can procure that as soon as possible, together with freezers and cold chain boxes. But I also like to highlight my deep appreciation to the public-private partnership you have mentioned, Peter, that made this initiative possible. The Private Sector Vaccination Initiative, PSVI, Ministry of Health and Wellness, and UNICEF have been constantly, almost daily, in communication to make this happen. He mentioned about Microsoft, but then we have been always talking, and WhatsApp was an important means of communication as well. This is a perfect example that public-private partnership can achieve a strategic and tangible result to increase efficiency and the inclusiveness of health service, and as a result to contribute to accelerate recovery from COVID-19 crisis, and that how sustainable development goals, in particular goal 17, that talk about partnership for development, is implemented on the ground to tackle the global crisis. The ministry has been using ComCare to facilitate registration for vaccination, notification of vaccination to users, collection of critical vaccination data, which generates real-time analysis of the vaccination initiative. Our goal is to help ensure that vaccination process is as efficient and inclusive as possible, and we are pleased that it has been working well. Later in the program, you will hear firsthand from the users about this. UNICEF stands behind vaccines. We know from vast experience across the globe that vaccine works. With each vaccine dose, we are providing added protection for Jamaican families, not only from the virus, but from secondary impact, which harm children now and threaten their future prospects. Vaccination is how we can rebound from what has already been a devastating impact for children and, of course, for their families. We are happy that there has been a strong uptake of vaccination to date, and we hope this will continue. And I just want to echo what Peter has said. We are absolutely committed to continue our support. UNICEF will be with Ministry of Health until this goes through, and then the digitalization goes across the health services. Thank you very much.
Thank you very much, Mariko, and thanks again to the team at UNICEF for their continued support of the Ministry of Health and Wellness. At this time, we're going to have remarks now from the Minister of Health and Wellness, Dr. Honorable Christopher Tufton.
Thank you very much, Stephen. And just to say that the Disaster Risk Management Act now allows up to 30 persons for occasions such as this. So we're halfway there. So we could have invited one or two other persons. Sometimes we are merrier with numbers. And this is such a momentous occasion. But let me begin by recognizing Stephen, our Master of Ceremonies, Director of Public Relations and Communications at the Ministry, Ms. Mariko Kogashima, UNICEF Jamaica rep to this island, and you said you took your second dose yesterday. All right, I hope you're taking a few Panadols every 6 hours and so on, right? And you're on the job, which is good. But we're happy to be able to accommodate you in that regard, and I know your job will be better for it because you're doing so much work. Peter Meledo, a longtime friend, representative of the private sector vaccine initiative group, and chair of the logistics and operation. Thank you, Peter. Thank you for your efforts, and thank you for being here. And please extend our thanks to the rest of the team, Chris Zaka, your PSOJ chairman, Keith Duncan, and others. Board chairmen, regional directors, parish managers, hospital CEOs who are online. So we have all of them online, Steve. So I just wanted to know that all the critical players throughout the island are here with us, even remotely. And so they are hearing all that is taking place. And of course, members here in this room with us, ladies and gentlemen, members of the media. So today is really a momentous occasion for so many reasons, and you would have heard the two presentations earlier, giving you several reasons for us to celebrate as a country. We continue, I think, to herald the mantra that partnership in public health is critical to our success, and the ministry, with all that we have done, has remained very committed to that cause. The truth is, health is about all of us, whether we're in the private sector, the public sector, the NGO space, the civil society space. Without good health, nothing that we really plan can be achieved, no matter how noble it is, whether it is the profit motive or it is just doing voluntary work. And in this particular challenge that we face, this partnership towards overcoming our challenges around COVID, we just couldn't do it on our own. And this is an indication of the benefits of just putting all the heads together and coming up with the ideas and thinking out of the box and being creative about it. I want to echo what you said earlier about Jamaica being a first. We like to be first, right? And you're saying that this combined effort between UNICEF, the private sector, and the Ministry of Health has created a software which has leveraged your experience in vaccines. Many people may not know, so it's good to say, which has leveraged the experience of private sector thinking, and of course the commitment, the philosophy of public health to work on behalf of the people of Jamaica to create what is a formula that the world can learn from. And that's a really good story. It's a good story. And in the context of the panic and the concerns around this virus, it makes it even more meaningful. So I really want to echo that and celebrate that achievement, and to say to others who may be listening on, we're more than happy to invite you to come and look at what we have done here, so you can do it elsewhere. The goal of inoculating some 1.9 million Jamaicans, vaccinating, right? So everybody can understand and appreciate. With the COVID-19 vaccine is a goal that represents one of the largest mobilization exercises that we would have done in this country, assuming that we achieve that target. You know, we are a colorful people. We have our own mind and our own originality. We do what we want when we want it. And in celebration of our democracy, we are given that opportunity so to do. It's not so easy to get 1.9 million people to conform to one particular activity, particularly if that activity involves them taking time to get a jab with a needle. Some people are afraid of the needle more than they are of the vaccine. And then, of course, having some side effects after the fact. So it is really a large exercise, and it involves a large cross-section of the society. So we have had to collaborate with international partners, UNICEF, and drawing on the expertise, of course, from the private sector vaccination initiative to set out to provide a solution that would allow us to the ease of data entry and analysis of the targeted population. Peter did say that I pushed the timelines. I'm very happy that we are there now. And I've seen the data, the software in action last Saturday, not this Saturday gone, the next one before, where I was able to observe, see the inputting, see real-time information. I was told up to the minute how many persons had gone through the process, male, female, and I'm sure you'll see some other features of the system. But data is fundamental to analysis and to quick response and quick action in whatever you do. And so to the extent that you can move so quickly, it really creates an opportunity for us in terms of the efficiency of the response. So today, ladies and gentlemen, we have the COVID-19 vaccine Coms Care software. That's Coms Care, COMMSCARE, that captures demographic and basic health information of over, to date, 160,000 Jamaicans who have so far received the first dose of the COVID-19 vaccine manufactured by AstraZeneca. So we now have all of that information on this software, and this is therefore able to help us in assessing where we are, where we need to go, what are the challenges in terms of those who may have had the vaccine, and so on. And it's important because when I operate on information, I mean, I'm one person who is oriented, maybe because of my academic background. Don't give me anecdotes, give me the data and what the data says. And sometimes you ask for the data, you have to wait because you're told that, boy, we have to get the box with the paperwork and we have to go check up and add up and tabulate and so on. Sometimes a day or two pass, a week pass, and you miss opportunities in terms of decision making. So what this allows you to do is to immediately make decisions, informed decisions. And I think that is a real big achievement for us going forward. So we have several data points at our disposal, which the Ministry of Health and Wellness is able to analyze, including data by parish, by region, doses, vaccination sites, time frame comparisons, and more. The software has been fully rolled out across the island in hospitals, health centers, and special vaccination centers. With the use of this technology, we can quickly report and announce that 10,608 Jamaicans have been inoculated with the second dose of the vaccine, while 815 have received their first dose during the blitz this past weekend. So this would be this weekend past. Now, I would have to say, wait a little for me to get this kind of information. I say, give me another week or so to pull everything. I can tell you right at the end of the day, which is an indication of the benefits. Leading up to the introduction of the software. So again, you're building knowledge, training persons. These trainers have gone on to train over 1,000 healthcare workers from across the island including medical officers, public health nurses, medical records officers, information technology officers, and community health aides. Now I want to deviate a little, as I normally do, by the way, from the script to say something about this, because we're embarking, and I'm going to just reference it, on one of the most significant digitization of our public health records that we, in our history as an independent country. And so this, to my mind, is a really good sort of initiation, if you will, on what technology can do in terms of data. The University Hospital of the West Indies started before in digitizing their records. I saw a critical piece in one of our daily print media yesterday, and I had a discussion with a journalist on it who called me. I have been attempting over the past 5 years as Minister of Health in pushing this initiative as part of reducing transaction time and cost, try to understand what are the major hurdles of digitizing and absorbing that change. And I tell you, the main hurdle, if we're not careful, are the people. People who are used to doing things a particular way, and they have a mental block, if you will, in adjusting to do it another way, even if the other way is a more efficient way. And my definition of efficiency is to reduce transaction time, transaction cost. That is efficiency for me. Getting things better done, quicker, at less cost. And so I appreciate the component of this software that has seen 150 trainers and some 1,000 healthcare workers. But I also want to encourage our hospital workers that we view this as something that will help them to be better at what they do. We know they're committed. We know they want to do good. We know they have made sacrifices. This is a tool of engagement that allows them and empowers them to be more efficient. And we're going to have to invest more, just referencing the article I saw on UE yesterday, in change management as part of our public health operation as we move towards modernizing our healthcare system. And we have big plans. We have buildings that we're going to build out under the IDB program. We have this health information system that is going to cost us, $8-9 million US. Next week or so, we're going to be announcing the preferred provider out of the tendering process, the procurement process, who will provide the hardware, the computers, and the network. And I think the team is now going through assessing, guided by the IDB, who will provide the software. But it's a big operation. But if the people do not prepare themselves and are not supported in preparing themselves to absorb, to adapt, to change, then you're going to have issues. I mean, I've seen very qualified, well-credentialed practitioners who refuse to use the digitized process because they're accustomed to taking the X-ray film and holding it up to a light and looking at it rather than going on their mobile phone because the thing is digitally sent to them and looking at it, and because they're not accustomed to it. They prefer to write with a pen rather than type a few basic information on a form. And so that change management is going to be absolutely critical. So I'm really impressed that we have seen that as an important part and have invested in it. So the ComCare software is a prelude, as I said, to what the GOJ and the Ministry of Health has planned as it relates to integrated technology in our public health system. And chief among those would be the health information system, which I announced in my sectorial. The government has made an investment of some $8.5 million US for a digitized integrated health system. I see the Ministry of Health and Wellness providing a modern and integrated digital healthcare system for Jamaicans from all walks of life. It will include high-speed internet and provisions for data protection, very important, we understand that, and will ensure that Jamaicans benefit from an electronic health record system which reduces transaction time and cost, and by extension, waiting time, because that's another big goal of ours, to get people in and out as quickly as possible. For example, when a patient goes to the clinic or hospital, he or she does not need to wait for 2 hours because the records are not now stored in a box or on a shelf in some record room. You can bring it up on the system and you'll see the history of the patient. So assessment of what is wrong, how to treat with it, what their past history is, allergies, etc., can be dealt with as quickly as possible. The multi-stakeholder National Health Information System Committee has been formed to support completing this process, and we have started. 105 health facilities will benefit from the announcement that we will make in short order around the provider of the hardware and the networking, 105 facilities. And we are working on a vendor to gradually roll out also home care telemedicine as we make telehealth and telemedicine our next big thrust. You realize what you're starting, right? You're setting a trend for so many things to come, right? Which is why I think this is a big deal. And because it's going to impact so many persons, 1.9 million, I want us to use this and to introduce it and expose it to every single Jamaican. In fact, when people come to register at the vaccine sites, I want to find a way to put it up on the big screen and say, this is what you're doing and this is how it's benefiting you. So that that absorption can be and that buying can take place right across the length and breadth of the country based on what we want to do. Healthcare has to change. If there's a lesson that we have learned from COVID, is that we can't do things the traditional way. Infection prevention and control measures are going to change. How we self-monitor is going to change. And that's why I spoke so extensively about it in my sectoral presentation when I spoke about this issue of being your own hero, making sure you monitor your personal health, making sure you avoid certain things, making sure you do more of certain other things. Hospital is not going to be the ultimate solution. It has to be what you do with yourself. And so this is what this process represents. So today I think, and I'm going to close here because I'm long-winded already. I've spoken long enough. This today I think represents a real paradigm shift. It's more than just the COVID management, as important as that is, and we do look forward to seeing the benefits of the software for that. It also represents, I hope, a signal to the country, to public health, that we have plans to make the service delivery a lot more seamless, a lot more connected, and by extension, reducing transaction time and cost. And in doing that, partnership becomes absolutely critical. So thank you again, and we look forward to the continuation of this partnership. Thank you.
Thank you very much, Minister, and we look forward to all the advances that will happen in public health, and to our partners, thank you again for your support. So we're going to see now a launch video that will showcase the software in action.
Comparing to the paper-based system, the tablet is much easier, it's faster, and I enjoy doing it. When using the tablet, you enter the person's name, date of birth address, and telephone number, their ID number, etc. When persons come in for the second dose, we will search on the tablet to make sure that everything is up to date, then add follow-up information to make sure that everything is correct, then we move on from there.
came this morning to get my second dose of the COVID-19 vaccine. The process was seamless. I did a registration process. It was no problem having my data entered in their system. The vaccine itself took 10 seconds, and the bulk of the time was actually spent waiting in the observation area.
All right, so as Minister said, we have it rolled out at our hospitals and health centers, and of course at our vaccination sites across the island. So thank you again to our partners. Our ComCare software is in action across the world. And first, right? It's a world record. It's a first. It's a world best. All right. So at this time, we're going to take maybe a few questions from members of the media. If anybody's online, they can use the raised hand feature on the Zoom to pose their questions to our panelists. In 5. Guess we're all clear. All right, thank you so much. So it's only there's one. All right, I think we have Jamaica Social, Cassius Watson.
Hi guys. Good morning. I'm just curious to anybody who can take this stuff. Envisage this with helping or in it or otherwise impact people's choices or not.
We're not hearing it clearly, Cassius.
How do you envisage this vaccine impacting take-up?
How this will impact take-up, the software?
Well, look at it this way. It is a tool of empowering the management and operation, both strategic and operational response to the vaccine program. So for starters, it gives you information, and information is power. So for example, you can determine down to the parish and maybe beyond who are the ones that have been vaccinated. It can allow you to dissect the priority groups and those that are not, so your follow-up response to that. Remember, we have some priority groups, 60 years and over, comorbidities, that sort of thing. So that kind of information gives you significant capacity to quickly analyze and to deploy. And there are elements of the program that are yet to be introduced, like a mobile vaccine initiative that will go into communities to capture those or to encourage those who need to be vaccinated. So from that perspective, it really is very, very important to have that kind of information. There are other benefits. I don't know if Peter wants to comment or, yeah.
If I got it right, I think you were saying, do you think it would help the take-up rate? I think you did. Yeah. So I think, what we set out to achieve is really that the big decision is to get vaccinated. But once you've made that decision, we want to make it as easy as possible for you to follow through. And I think between being able to go online, book your appointment, and then show up and actually be served in that 1 hour time slot that you choose, and as the lady said on the video, have a very good experience, I think that word of mouth starts to get out. So I think the idea behind this is to make it as absolutely easy as possible once you've made that decision to then go ahead and get vaccinated.
Okay.
As Minister said, that the Minister likes to see the data and then decide what to do. So this allows us to understand which groups are being left behind, and that makes it easier to come up with solutions. For example, probably outreach vaccination program can be set off so that we can go to those groups that are unable to move or come to the health centers, etc. So the availability of data allows us to think strategically how to reach the most unreachable. And I think that's the contribution to increase uptake of the vaccination. Thank you.
All right, thank you very much. I think another question that we have is a general vaccination question. They're asking, when will the vaccine be rolled out to the rest of the adult population?
The, the timing is to be determined, and it's a function of a few things. It's a function of availability of vaccines. So to the extent that we have more vaccines, then we will open it up, as we did the first blitz when the entire population was allowed to come in. It's also a function of the progress we're making with the priority groups as they have been outlined. So to the extent that we finish one group, we go to the next. So those would be the sort of principal considerations. But old strain, we're working on some specific initiatives, and I'm sure you'll hear more about that as time progresses. Thank you.
All right, thank you very much, Minister. And I just want to thank everyone. Thank UNICEF, the PSVI, and all our partners, the health team. Thank you so much for your support. We had another question, Nicole? I think we can allow one more question before we close. That's it. We're going to end there. Thank you so much. Thanks to everyone. Have a good rest of, stay with us. Have a good rest of day.
Jamaica, home of the resilient, passionate and hard-working. A people and a nation who have achieved and defied all odds, working to keep their economy